allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Everybody have a chance to review the minutes? Second. Favor?
Aye.
HE1.
HE1 is a resolution requesting the reappointment of Dr. Marie Desravine to the Board of Health for a 6-year term. Dr. Desravine graduated from SUNY Upstate Medical University of Medicine, Syracuse University, New York Upstate Medical University in 1993. She works in Fulton. She has 5 other locations throughout the county where she provides services to families. She specializes in family medicine. Dr. Desravine is affiliated with Oswego Health. She has been on the Board of Health since 2012 and has served in various roles on the board.
So, we have a motion for discussion.
Move. Second.
Second. Any discussion? She's a very active member on the board, participates, has good comments, good questions. Not afraid to push the button if she doesn't agree with what it's being discussed. Any other discussion? All in favor?
Aye.
Opposed?
Thank you. HE2 is a resolution requesting the authorization of a budget modification due to increased legal fees associated with the illegal vapor product hearings, increased fine revenue line of $3,000, and increased other fees and services to $3,000 with no local share impacts. The hearings on flavored vapor products are complete. The board has passed resolutions and made orders on 3 of the shops to pay fines. They have not paid. And our legal office is moving forward with enforcement with the Board of Health orders. The costs have gone not only towards the hearings themselves, but scheduling and rescheduling of the hearings, a motion before the hearing officer, and various correspondence, along with the cost of the hearing transcription. Some of these led to negotiations on 3 other cases, which we expect will lead to a payment of certain fines, and also appears to have led to a voluntary closure of one of the shops in an agreement. There has been correspondence and hearings with 2 other matters with transcription costs. One, a TUPA, the Adolescent Tobacco Prevention Act paraphernalia hearing that is expected to lead to a payment and an understanding of the owner.
So, motion to discuss. Right. If we have specific questions about any of these cases, we need to go into executive session. So that's up to you guys. Would you prefer to do that?
No.
General questions about the moving of the money, we can do that. If you have questions about some of the cases, we need to go into executive session because that's not public information at this point. All right?
Yeah, the fines. You said nobody's paying their fines yet, but how much fines are we talking about? I mean, what do you expect? What's your expectation for us annually in fine collections?
Annually in fine collections, we budget for this year,
We typically only budget $1,000 for fines because we can never count on there being cases where we're going to incur fines, so we don't ever budget a large amount of
So,
money.
for instance, how many fines did we collect last year?
An
idea.
I don't know if we had any last year. These cases, I believe, were started last year and they're being resolved.
Is there going to be sufficient funds in there to support the legal fees? We're not collecting any fines. That's my point. And then second, if the fines are going to exceed a certain amount, $30,000, $40,000 in the fund, so I'm just asking what your expectation is. Will it be able to support the needs or
Legal is moving forward to, those legal fees, so we're hoping that we'll get.
we don't know. Right now, it's an unknown.
That's correct.
Okay. Thanks.
We don't see the money till we see the money. This point.
Can I add something?
Yeah, go ahead.
If we do not end up receiving any of the fine payments, the expenses are eligible for Article 6 state aid reimbursement. So we will get some form of reimbursement. It wouldn't be 100% like if they didn't pay the fines, but we will have some sort of reimbursement at the end of the year.
I guess we can revisit this next year and see how it's going.
We've had a discussion with Bill and NICEAG about changing some policy procedures for this program, but that we discussed another time.
It's a very good, it's a difficult program, and all the counties feel the same way.
Any other questions? Okay. All in favor?
Aye.
Opposed? Motion carries. Thank you. Ian,
So we are participating in the Public Health Win 2024, which is the fourth national survey of state and local health departments across the nation. The survey is being conducted by the G. Dumont Foundation in partnership with the Association of State and Territory Health Officials. Public Health Win assesses the perspective and skills of all employees within our organization. The survey will ask questions on workplace topics such as culture, morale, satisfaction, and training needs, as well as the demographic characteristics. The findings will support investment in the workforce improvement and development of our department, and not only our department, but nationally. This survey will help identify the current needs of our department and highlight opportunities for improvement. The results of the survey will be used to inform, guide workplace enhancement and development and training. Our environmental department, mosquito surveillance continued through September 27th, as you all know. It was a very busy mosquito season. As of present, we have been putting up Fight the Bite signage throughout the county, including the parks, at the drive-in, playgrounds, campgrounds, restaurants, especially near the fish hatchery, urging people to avoid getting sick. We've also been supplying bug wipes and mosquito spray throughout the county school districts. Fall season brings an increase to temporary and mobile food services, so we're busy with permits for fall festivals and salmon season. On August 7th, we held our rabies clinic at the Parish Highway Department, where we vaccinated 162 dogs, 36 cats, for a total of 198 animals. Good morning. Our next scheduled clinic is scheduled for November 17th, and that will be held at the Oswego Town Highway Garage. The Silk Road landfill, we repaired the non-functioning flare, plus we dewatered 6 of the gas vents that were flagged during the B&L second quarter inspection. Our next step is to repair or replace the PVC pipes that have been damaged. Public health, education, emergency preparedness, evidence-based classes are started on the 25th, where we actually got to turn people away because we were full. Diabetes self-management is planning to start October 10th. We are working with Jason's House to hold a chronic pain self-management class, and that is date. We haven't came to date yet for that class. We're planning on overdose fatality review, tabletop exercise with our community partners. Our continuity of care operations plan has been revised and we continue to make revisions as needed. School presentations, we continue to provide educational programs about the hazards of vaping and the impacts of brain development in young children. In 2024, we have done approximately 88 presentations with the school-aged children. We've also done several tabletop events with information on risk vaping and smoking at our community events. In addition, we have developed materials on services on how to quit and where to get help quitting smoking and vaping. We are also in the process of developing an emergency preparedness activity book for children. It's very cute. When it's completed, I will bring it here to show you. Healthy Families Program. Our Healthy Families Program continues to be above capacity at 108%. We are placing families on a wait list, and currently we are at 25 families on that list. We have received a revised award letter from the Office of Children and Family Services to initiate the Child Welfare Protocol and to increase the number of families that we serve from 40 to 54. Due to the increase in families and the OCFS formulary to meet the needs of these families, we will need to add 2 more staff members to the program, and that will be funded at 98%. We are hoping to have everything approved by December 1st to begin the process. The funding is enough to reduce the local share as the program is funded at 100%. So, our team, we're doing great work and being able to handle what we're doing. The team is also planning for the fall harvest for the families in this program. Preventative services have been busy with the back-to-school vaccine clinics. We have added an additional 3 to 4 extra clinics every week, including evenings and we did a Saturday, to accommodate the need. That was the weekend that the power was off in the building, and we actually worked with Riley School and the clinic over there. So that was. Unfortunately, we did have a lot of kids get excluded from the schools through the month of September. As of August 1st, we administered, not September, August, we've administered 420 vaccines, and that's school-age children alone. We will be administering flu and COVID vaccines starting this week on the 4th. We have scheduled 10 additional off-site clinics in October so far, and we do plan on doing the homebound patients also throughout the county. COVID-19 cases are increased. Our report cases in July were 206. In August, we had 365. In September, we've seen that number increase to 732 cases. We have been receiving many calls about the isolation paperwork that they're finding online. The health department no longer issues isolation paperwork and quarantine paperwork. So we looked into it and found that it was ghost sites that are on the website. And if you Google search or search in the search box on the county website, you can pull up these websites. So we've been working with the department editors, which they have done phenomenal, get rid of those ghost sites. We've seen 11 flu A cases so far this season. That number will increase dramatically as we go through our winter months. And please don't forget to visit the respiratory website. It's a new dashboard that was created on the county site. Children with special needs, early intervention. 53 early intervention aged children were eligible for the fall transition. 49 of those families returned their consent and would like to continue with the process. 33 EI referrals were received in the month of September. Staff met with the DSS Children Protective Services and Family Services and explain the program and what's available to the children with special needs in our community. Parent packets have actually went over very well with the OBGYN and pediatric offices, so much so that they called for replenishment, which is wonderful. 22 CPSD, that's the Committee on Preschool Special Education meetings, were held in September. We anticipate the increase of these meetings as the newly enrolled UPK, which is the Universal Pre-Kindergarten, and Head Start children are referred for evaluation. Our special education specialists will be providing an in-service training to OCO staff and with their Head Start on October 4th. And the focus is going to be on pediatric physical therapy and occupational therapy.
Sure, I just want to go back to the overdose prevention division update.
Sure.
It looks like our fatalities are spiking a little bit now.
They are.
Before they weren't, now they are. And I see 0 for August and 0 for September. So these must have been reported later after the fact.
They do, the reports come in later. So this, the data on fatalities, sometimes we don't get it for months, right?
All right, so it looks like we have less incidents this year as opposed to last year, almost 100 different.
Yes.
And we have twice the fatality rate. Any idea why that's happening? Why are the fatalities happening last year?
Than they were last year. Because we have been flooding the market with the whole county with Narcan. Anybody that wants Narcan wants the whole Narcan, and I think that's helping. But it might be the strength in the fentanyl and what else is in there. We're seeing a lot of combination drugs where it's just not only fentanyl, but several other drugs and the drugs that the members are using. So I believe that may have.
Yeah, nice that pointed that out. I'm on the public health member of the committee. That fentanyl is just becoming it's getting mixed with everything.
It is. Before we would see heroin, fentanyl, and now we're seeing Molly mixed in other medications.
Any other questions? That was quick. We take a minute. Would you explain the rabies program next year that you don't have, right? What you need to do, the same number of clinics?
Today, you want me to do that?
Well, I didn't say we were going to do any approvals today, but let's set the tone so that we can have that discussion.
Okay, so by public health law, we have to at least hold 4 rabies clinics per year. Our county usually does 6 to 8 rabies clinics per year. But we're only mandated to do 4.
So that's a discussion for probably next month. We'll start talking about that because they used to pick up more than 4, didn't they? Or has it always been 4?
I don't. That was before me, I don't have it.
Yeah, or as long as I can remember.
Or as long as I.
So this conversation is happening because you're looking to cut the number of rabies clinics you have next year. Is that why we're having this discussion?
I don't think she's looking to cut it, and I'm not looking to cut it, but that means if we do 8, we're paying 4.
How many are you paying for now?
8, we do 8.
We get, well, the state's paying for all 8 of them?
No, the county pays for them. We get some, we get
So
some.
nothing really changed then. What's changed? The state paid for 4, we do 8.
She wanted us to have the discussion because of budget.
Cuts that we needed to make.
I'm not in favor of cutting rabies. Let you know right now, I'm going to argue. So particularly in the areas with the map, all the raccoons have rabies. And all the clinics here.
Committee has to, yeah.
That also
Depends on
remind
the
the
cost.
committee that the rabies prophylaxis, which is required after an exposure, is also paid for by the county. So
Frankly, I can't remember whether I kept that in or not right now.
Well, it depends on the cost. I mean, it's an excessive expense, that's something we should discuss.
That was my,
I have to-
that was my indirect way of telling you to make sure you did.
Yeah, and, I have to compliment her and her staff, all the departments that ultimately did the best in trying to compensate within its operational budget for labor cost increases. Did a good job. But I also know some of that is near and dear stuff that our constituents want, so we need to make some decisions going forward how much gets covered.
And that will be discussed at the next health.
Yeah.
And I'll have all the numbers. So we can make good informed.
I just wanted to put it on the table to think about it. I appreciate opinions, but we'll talk about that next month.
Rich, did you say that if there is some member of the public is exposed to rabies, we put the bill for the shots?
That's correct.
That's great.
So if you cut back, you're gonna see more of those, right? Possibly.
Potentially.
Yeah, so.
There's more rabies in the county, there might be more exposure.
Right, so,
How many exposures do we have this year? Not many. There's not, this isn't like a plus.
The series is expensive.
Yeah, the shots are shots, yeah.
I think that's, she's
No, they don't do stuff.
We've had 9 positives in the county, but we have done post-exposure treatment on 49 cases.
That's a loss for that thought.
again, it could potentially go up if they cut back.
That's because they don't know if it's positive or
That's
not
correct.
until they have to start the shot. They
The
have to
ones that
start-
let them go.
You might get rabies.
Right, precautionary. Yeah.
Right.
So
yeah,
we try to put out the messaging to call us if there's that and I'll don't take it. Because if we send it for testing, that will prevent the post-exposure treatment.
Any other comments or questions? Okay, entertain the appropriate motion. Second. In favor?
Aye.
Thank you.
Thank you.
My cousin's pharmaceutical, does a lot of pharmaceutical companies, he is very, so he had to go through this.